Hello?
How you doing?
Not doing any better, that's for sure.
Oh, I'm
I
sorry to
mean,
hear that.
I've been doing, a lot of mind, body, stuff like that. I mean, it's helping. It does help. And I'm glad that I've been learning that stuff over the years. And now I'm doing a class that has nothing to do with you guys. It's completely separate, but to help calm down the nerves, so the nerves aren't so hypersensitive and things like that. It's like a 4 month course, and I'm a few months into it. So,
Yeah, it's all an adjunct. You're doing this in kind of concurrently with potentially having to revisit another surgery.
hmm
So you essentially just preparing. The same way where an athlete kind of prepares for a sporting event, because if you do undergo any kind of additional intervention, you're going to be putting your body through a lot of stress.
right.
So if you're able now beforehand to kind of prepare for it. If it gets to that point, then that's essentially what you're doing. So it's not um, you know it's not lost. Uh, and I know you sent here. Let me share my screen. We reviewed all of your stuff last time or last night with the new images. Unfortunately, the newer images that you obtained are not as detailed as before,
Okay.
but it gives a snapshot, because before I really took everything in context, right? Where your head is positioned, your upper thoracic spine, and in your lower back. And for the most part, you're still, you're standing perfectly in line, very neutral. Um, the image on the left is your more recent one, so it only gives me like a small picture of what's going on,
Okay.
which is upper back, and then I would have to kind of stitch it with your lower back. Your lower back looks fine from my standpoint. The upper part of your neck, everything is still there. This is the part that I was a little bit worried about. This upper thoracic region, um, but here, relative to what you were before, it's the same. It didn't get worse.
Okay. Because it feels like it's getting worse.
You mean you feel like you're more hunched forward?
Absolutely. Yeah.
Let me see. Because then, if you do feel that way, it might be worthwhile to get one more of these images just to really see it all together. Because right now it's all stitched separately. It doesn't look that way, but the only way to be sure is to take the picture in one snapshot.
Right.
And the next conversation is, if it does feel that way, what's the game plan?
Right.
Like, you to do differently. Like, how have you been able to? Because last we spoke, you're still working on cutting back on nicotine.
Oh, I haven't been smoking for, well, since June, mid June last year.
Wow, that's amazing. That's
Yeah.
really good.
Yeah. No, I mean, smoking is not even an issue anymore. And I'm happy to say that. So,
That's
and I'm
fantastic.
still
And
working with my physical therapist every week. We're doing that and he's just doing physical therapy and also dry needling. And he said that he's sending in his reports, but he says that visibly he can see a difference in my back. So he's
like,
concerned that, that it's getting worse as well.
yeah. So we definitely, pictures are one thing, and it's also about how you're feeling. So everything into context. So congratulations on the no smoking, no tobacco use.
Thank you.
That I can't imagine that was easy at all.
Mm-mm.
It multiple positive benefits for you. Again, it's also part of the game plan that if you do need surgery, you're going to do much better as a result. Um, Now, my sense is that it's not necessarily structurally getting worse. that you're probably just feeling more pain just because you're trying to work more, but you're kind of stuck in this, what we say, kind of hunched formation, and you're just tiring out more. So, and it's mainly maybe your lower back, or maybe you're finding yourself hunched more at the end of the day. Because when we had, and I'm going to pull it up again to double check, when we had a CT of your thorax, your bone scan looks good as well, which is good. Your CT of your thoracic spine is a little bit older, but it didn't show anything being pulled out. Which is the problem I think you had at this level.
Right.
The revision surgery.
Yes.
Now that being said, we can do two things. We can get a new CT, cervical thoracic.
Okay.
Do X-ray of the scoliosis just to kind of confirm that structurally you are where you were before. But then the real question is what do we want to do about it? Are you at a point now where you feel like nothing is helping and you can't live like this anymore, and you want to try to do essentially an elective surgical procedure, high risk, that would entail, again, kind of breaking this bone and then again re-instrumenting you from the top down to the bottom, probably somewhere around here.
Right. So I'm waiting on the hospital they're doing some testing for POTS. Because I'm having a lot of heart palpitations, and it's the more I do, the more issues that I have. And so my PCP, their concern is that it is because of my curvature. I'm doing less. That's for me at this point. It's my quality of life.
Yeah.
And I have given up pretty much everything. And like you said last time, I'm too young. I'm too young to not have a quality of life at this point. So I know that this is really an extensive surgery. I get that. I understand that. But how am I going to get fixed otherwise and get my life back? Or at least some of it. I'm not unrealistic. I know I will always have some sort of pain that I will have to deal with. I know that I will always have limitations. But it's weighing that versus is this just going to get worse and worse? I don't know where you stand on this, but Dr. Kirshner told me that it's pretty much two options. Either my back will eventually break in half, or I have to have the surgery.
Your back will not break in half. And I'm happy. Yeah. I mean, we all have different thresholds. We have different kind of approaches, styles. I told you, you walk into any spine clinic. I think let's see, are you from Arizona? Or are you?
No, I'm in Colorado.
Pretty much any private practice spine clinic will offer you surgery immediately. I don't think they'll take the time to work with you in terms of the tobacco or the nicotine abstinence, all this pre-op kind of training that you're doing to prepare yourself to recover sooner. My approach is really optimize you, and the right procedure for the right patient, you'll do very well. You already demonstrated objective signs of multiple failures, so you don't want this to be like another quick fix.
No.
Just throw a random plan at you and put in a lot more screws. This needs to be methodic. This needs to be planned out. This is a different approach.
Right.
And I don't think all surgeons see that, and that's why I'm putting so much details in your notes just to help really break it down. Why it's important that we have to address your curvature here, and why, unfortunately, the next surgery is going to be a lot longer, meaning entail a lot more levels all the way down here. We'll be able to fix it. Your curvature will go from what you have here to probably something like more in harmony. So it'll be a little bit less. it'll be here instead of all the way back there.
Right.
But doing all the things to kind of prepare for it. I think if you're getting, are you, in terms of the pots, that's also important to kind of just tease away, just because post-operatively you might, if you have an operation, you might be dealing with a lot of those symptoms. So if it's something that you can tease out now with additional laboratory stuff, then it just, again, helps you prepare for it afterwards.
Right. Right. Yeah, but yeah, you know how it goes. It takes forever to get into anything. So hopefully I should get a call. I was supposed to get a call yesterday to schedule it, but just waiting on that.
Yeah.
Yeah, and I know that it's huge to, also eliminate things and all that too. So
I think the reasonable next plan is while you're working on that, let's get, and I hate to subject you to more images, but if it sounds like we're getting closer to where it's like you want to do something about it, I would like to get a new X-ray scoliosis, new CT of the cervical and thoracic spine.
Okay.
And your bone density was great in May of 2024, so I don't anticipate that to be a significant issue, but we can get that closer to when we actually do the operation as well.
Okay. All right. And I don't know. I mean, I think I'm at a point where I have to get this fixed. I can't have this quality of life. But if there's some things that you feel more things that I need to do before, I'm willing to do whatever needs to happen. But I know that it's not going to fix itself.
Yeah, no, I think you're doing all the right things. I think at this point it's more of the planning that I need to kind of confirm with some of our guys here.
Okay.
And if you move forward with this surgery, it would also entail plastic surgery for closure as well.
Okay. All right. Yeah. Well, so yeah, that was part of what I was told before, is that my muscles have been torn, but I'm not sure that that's even the case from my last surgery, because they didn't have a plastic surgeon there to take away the muscles and put them back. So
yeah, no, I mean, normally we're able to do it ourselves, but it's like if you had so many revisions, it's just it would be a lot more cosmetically appeasing too for you to be able to fix all of that.
Right. Okay.
Okay. So would you like to wait for your workup to be completed, or did you want to order?
No, let's go ahead and do all the workup stuff, and let's get that back and then go from there.
Okay, that sounds good. All right, I'll place the orders from my side. Sorry, the workup for the deformity correction. Okay.
Yeah.
I'll place the orders from my side, and my team will be in touch with you about getting it done. And as those are being completed, we'll be able to finalize the levels, and I'll give you more details.
Okay.
About what surgery entails, and I also run everything kind of through like a simulation model, so I'll be able to show you kind of what we're going to be doing to your spine.
Okay. All right. Yeah, that'll be good and helpful.
Yeah, no, I want you to be very well aware and attuned to what we're going to do.
Okay. Yeah, no, I appreciate that.
Any other questions?
No, I don't think I have any other questions at this point. And then I'll just make sure that my POTS information also gets sent over.
Yeah. And again, congratulations for the nicotine.
Thank you. Thank you. I appreciate that.
All right. Keep up the good work.
Okay.
We'll be in touch.
Okay. Sounds good. Thank you. All right. Bye.